Please go ahead, sir. We are live now.
Varun, can you hear me?
Varun, Varun, sir, we are live now.
Okay. Varun, can you hear me?
I can hear you, but I cannot see you.
Okay, give me a moment. I'll stop the video and then go back. Even now? No. Okay. I can proceed without video, no problem, right? In the interest of time. Okay.
Good morning, everyone. I welcome you to this virtual roundtable discussion on waste care through technology. To start, I would request the Chairman, Dr. Lovneesh, Vice President of Government Relations, ATS in e-commerce, to please deliver the welcome address. Over to you, Dr. Chanana.
Okay, thank you, Varun, and a very good morning to all of you, and thanks to all the panelists for making it here on this very important topic that we thought we can have a quick 1 hour discussion around how technology can help the management of the elderly care. That's a very pertinent topic, and the reason we at ASSOCHAM thought about organizing this discussion is simply because there was a lot of discussion and belief that came up during many of similar engagements that the technology for elderly care is one area wherein in terms of the reaping the benefits of technology, the fruits are really low hanging in terms of the business case, and the impact that it can make is huge. Vis-a-vis the gap between the realization that all of us are worried about. Now, if I look at some of the statistics, if I look at the UN FPA report, it says that in 2018, 6% of India's population was up 65 and above, and by 2050, we'll have as many as 34 crore people above the age of 60. That's the kind of distribution, and it is not only the quantitative part, it's the overall distribution also, that we see a growing number of elderly with, obviously, with chronic some of them with chronic diseases and disabilities. Second, from a societal shift perspective, there is a focus on self-reliance as far as old is concerned. The families are no longer joint families, and therefore the focus is on. And then there are obviously age-related challenges like the physical limitations of balancing, reaching, the perceptual challenges of vision, hearing, the cognitive challenges of memory and parallel tasks. I thought this also was a good event, good thought to actually address some of the myths that older people are less interested in learning how to use technology. Right? That is something that is a common understanding, or some would also go to the extent of saying that they simply cannot learn how to use these technologies, or they are anxious, or have slightly different attitude towards usage of technology relative to younger adults who which probably leads to non-use. Now, and when we look at what can we, so why we organize this is as I mentioned, these were the reasons. Now, when I look at some of the areas where initially we thought the technology can help, and they actually need help in all daily activities. They need help for personal grooming, for transportation, for cooking, for reading, social engagement, the memory functions per se, the health monitoring, which is a very, very key area, and obviously some of the thought processes also to remove the burden from caregiver. Now we have already seen a shift towards assisting elderly with technology. Some of the initiatives like smart homes, some of the initiatives like mobile devices or wearable devices, even smart fabrics, or and now lately assistive robotics actually have already been developed and are being offered, and I'm sure during the course of the day we will have discussions on a number of such things. At the same time, in terms of application and the ecosystem, there are issues that all of us observe. The issue of still a limited bandwidth access to internet in terms of the infrastructure. Most important to me in India's situation is the lack of awareness on what technology can offer. And that is predominantly due to inadequate or probably some gap in the marketing and advertising and positioning of these solutions, and to some extent there is a belief, I don't know how much of it is true, but that the belief is that solutions are designed, IT solutions or technology solutions are designed keeping young in mind, who actually have grown up using this, and hence the shift to focus, and government on have taken a number of initiatives, whether it's the national program for healthcare of elderly, that's NPHCE, or the Rashtriya Vayoshri Yojana, or the Senior Citizens Welfare Fund. There are a number of initiatives that government has taken. I think we have a platform ready on which we can build now, and take this next wave of technology assisted or technology led elderly care. And once everybody sees the what's in it for me, the adoption to me would be rapid than we have seen anywhere, and we have proved it in India a number of times, whether it's the number of Jan Dhan or the others we have proven. So looking forward to a very interesting deliberations on this important topic, and I welcome you all again, and hopefully by the end of this particular discussion, we will have concrete actionable areas that we can go back to each of the stakeholder groups, and have and kind of try to work a plan around that. Thank you very much, and I look forward to the discussions. Back to you, Varun.
Thank you, Dr. Chanana. Can I request Shri Abhinav Singhal ji to make his presentation and team address? Please start the presentation.
Thank you. Hope you can hear me. Just wanted to confirm. Can someone confirm if you can hear me all right?
Yes,
Gaia,
we
go
can.
ahead.
We can.
Okay,
Please go
thank
ahead.
you very much. All right, look, first of all, I might start with an apology. This is a technology-oriented event, but I've been having a nightmarish technology day with Bebex, which is quite ironic. But look, it's this reality of life. Some things we take for granted, they don't work. So I'm right now joined with my iPhone as well as an attendee. But I hope, I had prepared a presentation with animations and so on, but I'll try and do the best. I've had to give my presentation to one of the colleagues. So I'll speak through the slides and hopefully you can follow through. So look, in doing that, I forgot to wish you good afternoon. Hope everyone's sound and safe. And I would like to firstly thank ASSOCHAM and Dr. Lovneesh. Some very wise words he said. And thanks for giving me the opportunity to be part of this event. And I also acknowledge everyone in attendance today who has come to learn and share insights on how technology can assist in providing better aged care. Look, it's an important topic, close to my heart. I don't have to think it impacts everyone, right? At some stage, directly, indirectly. So, don't have to say a lot about that. But by way of introduction, my name is Abhinav Singhal. I'm born and raised in India, but I've had the opportunity to travel, work, and live in several different countries. I'm joining from Sydney, Australia, where I live now. I'm also the founder and lead of SAP's social venture, Digital Age Care. I'll talk a little bit about that, but I think more importantly, the topic of aging. But look, before I get into the topic, it'll be remiss of me not to acknowledge these unprecedented times we are living in. Right? Countries across the globe are facing challenges in ways not experienced during a lifetime. But where there are challenges, there are also opportunities for innovation, right? As we say, there is silver lining to every cloud. Can you go back to the previous slide, please? I'll let you know when we have to move. Thank you. Look, despite the impact on the broader economy, the COVID-19 pandemic is accelerating the uptake of technologies, especially in sectors such as healthcare, of which aged care is a part or a subset. And this is being seen both at a consumer and corporate level. COVID-19 restrictions and our new way of life means that empowering people, communities, governments, and businesses to digitally transform is more important than ever before. So we at SAP are committed to supporting this transformation every step of the way. Look, back to the core topic, aging. And aging is a topic that, like I was saying, touches each one of us. Aging is inevitable. We all know that, yet we do not want to talk about it, right? There's something taboo about it in some people's mind. At least we don't do that with a lot of interest and enthusiasm. Our attitude towards the topic is often, let's just say, indifferent. And I'll give you an example, right? So think about it. There are two stages in every human's life when they are at their most vulnerable. The first one is when they are born and in their years of infancy. The second one is in their twilight years, when you're old and start turning frail. However, our attitude towards an infant tends to vastly differ from that towards our elderly. Right? We shower our babies with unconditional love, affection, gifts, care, you name it. I'm not sure if I can say the same when it comes to the caring of our seniors. So definitely something to think about. So look, if you can move to the next slide, let's look into some analysis and insights from data, right? So let's look at the major trends that are fundamentally transforming elderly care. So look at the top bar, some global and local trends. On the positive side, people are living more and more, right? A phenomenon which we should all celebrate globally. Globally, the population of seniors is growing faster than all other age groups. In India, the current senior citizen population is around 130 million and is expected to more than double to 300 million in the next 2 decades, making India the second largest global population of elderly citizens. As you can imagine, the need and demand for aged care is only going to go up. But also let's look at the supply side of care. Over the last generation or so, we have seen the move from joint family system to a nuclear family. In addition, people have been migrating away from their native places, either domestically or internationally. Now, both these factors have had significant impact on the traditional family or community-centric care model, right? Putting at strain our existing system. Overall, then, if you look at it, what a lot of people are talking about is an advent of a gray tsunami. And I mean that in the most respectable way, right? This is happening across the globe, but especially relevant in the context of India. Look, but it's not all doom and gloom, right? So let's talk about a few of the positive trends too. So if you look at the 4 boxes underneath that bar, right? People now more than ever can age in their homes or wherever it is they call home. That's where they want to be rather than an old age home, and they want to age with dignity and independence. Number 2, the top right, we are steadily moving away from one-size-fits-all concept of care, right? We are all different. Our DNA, our health issues, our goals in life, our lifestyle. The care needs to suit us, right? So that's an important thing to keep in mind. Number 3, bottom left, which is super critical, right? With technological advancements, we are now increasingly able to monitor for any changing patterns, health ailments, physical or mental, and go for early intervention. Overall, and that sums up in the form of a large macro trend, technology which was considered as a hindrance, and in the last 10 or so years quickly has taken the role of a companion, a friend, and an enabler. Think of apps like WhatsApp, YouTube, Ola and Uber, Flipkart, Paytm. The list is quite long. We can see technology becoming quite pervasive in our daily living, which has obviously helped in the adoption of technology. In addition, in the context of India, there's a large population of tech-savvy retirees coming up in the next 5 to 7 years. People who were in their 40s when the internet boom happened in the late 90s and early 2000. So overall, we should expect more and more people embracing technology with time. So now then, allow me to switch gears. I also want to talk about what have we done or are doing at SAP in regards to addressing this topic, just at a very high level. So if you could move to the next slide, it'll give me an opportunity to talk a little bit about the venture. So at SAP, we have a social entrepreneurship program, and digital aged care was the venture of choice in 2018. At a fundamental level, our goal is to leverage technology to transform the aging experience, right? Dr. Lovneesh mentioned various ways in which technology is being leveraged, and we'll talk a little bit about that. But look, at a high level, it's about helping seniors live longer, healthier, and happier. For a lot of people, it is about the ability to age at home, right? Have more confidence, remain active, and in control of their twilight years. That's what drives them. And technology can be their partner in making this possible. So let's see how, if you can move to the next slide. Thank you. So look, it's a busy slide, but this is a high-level concept view, and I'll try and orient you through the slide. So at the center of it is the elderly people themselves, right? If you look at the right side, you can see various ways in which we can monitor some of the call observations in and around them, right? So the product overall leverages smart technologies to monitor certain parameters. It includes your basic physical observations, so things like your heartbeat, steps, sleep pattern, blood pressure, etc. But also at the bottom right, the spatial parameters, right? Your activity, where you're spending your time, some safety features, and other senses. The product, which you see in the middle, just a representation, is then able to run analytics and machine learning algorithm on the different data and generate insights, right? So data gives you a lot of insights into what's going on. So real-time alerts in case of fall or distress, long-term trends and patterns, changes in daily activity pattern, for example. It can also help us predict risks or onset of health issues. So think about depression, people are not moving around, spending time indoors more, onset of dementia, a big issue, and so on. Now, these insights can then be provided to the various stakeholders in the individual's care circle. So you look at the stakeholders on the left side. So for a family, for sons and daughters, it's a peace of mind, right? People living away from their elders or parents, that's number one priority. Now, spare a thought for the almost always overloaded caregivers. Effective use of these technologies can help caregivers to offload certain work areas, thereby allowing them more time to perform tasks that essentially require human touch. For instance, a health app can not only accurately record, analyze, and update patient vitals such as blood pressure or heart rate, but can also relay any inconsistencies to the caregiver or doctor online. So a boon for care providers in that sense. Last but not least, governments and health departments, they are able to drive the goal of citizenship welfare, and in a lot of countries, even drive optimized budget spend. Right, so if you look at it in summary, with a platform like this, everyone wins. So let's go on, maybe move to the next slide, slide number 5, please. Okay, so I want to quickly skim through the next section of the presentation, which is about our journey, right? So most importantly, how did we build our solution functionally ground up? Now, we've been working very closely with the seniors and keeping them front and center at all times. All of us have older people in our friends and family network, so we never had to go very far off to find our users, right? It's important to find out what they feel about it. Will they adopt? The biggest question, what drives them, and so on. So please go to the next slide. Thank you. So look, these are pictures, but there's a unique story with every face you see in this slide, right? Progressively, we started working on pilots with organizations in the sector, retirement village, home care providers, nursing homes, hospitals, and so on. We initially started in Australia and then slowly spread our roots to Japan as well as to India. And this is a topic of relevance for almost all countries across the globe, as you can imagine. Like I said, every individual on this slide is a unique story, and I can tell you it is perhaps the best feeling in the world to be able to give some confidence back in their lives, right? Give them some control and bring a smile to their faces, right? Nothing beats that feeling. Just maybe the next couple of slides I'll go through very quickly in the interest of time. So if you move to the next slide. So these are some insights we captured, quite important. I don't know if we are able to share these slides, but these will, I'll try and make these available. But look, some of these might be common sense, but if you look through it, what drives an old person, right? They don't like to ask too much support, right? So they're like, am I a burden on my family? They don't want to accept they're losing independence at the same time. They want to do things on their own. They don't want to be a burden. And they now stay, and this is a growing trend in a lot of countries, they're staying more and more at home. They have the independence and so on. They don't want to be in an old age home or a nursing home where it could be very depressing. They don't want to let people know if they fall or they're feeling unwell. Again, the concept or the mentality around don't want to be a burden. And the last one's also important, which can sometimes be like, okay, how does technology work with that? They don't want to carry something which will make them look old, right? So when we design devices, we have to bear that in mind. Now, on the other side, seniors felt an increase in self-confidence through better visibility, right? You're able to set a goal for yourself. I want to do 5,000 steps a day. Okay, I have to do it. It sort of drives them. They felt the insights from we're able to enable better engagement with the family. So there's discussion. And, there is reasonable willingness to adopt technology if, these parameters work in their favor. So maybe just move to the next slide. And in the next slide, you'll see, what we started doing was with, when we had a basic product, we started working with the organizations, right? Retirement villages, aged care organizations, nursing homes. And on this slide, you see feedback from some of our pilots, right? So the first one's from a home care company in Australia, who we've been co-innovating for a while now, and we're rolling out more and more functionality. The middle one and the bottom one are two providers in India, and we have been running, bigger scale pilots, I should say. And again, we have to localize the product, so I think that's an important element as we roll out a product in a market. So with that, maybe just the last slide. I'll leave you with a couple of thoughts, right? So Gandhiji had actually remarked, a nation's greatness is measured by how it treats its weakest members, right? So again, words of wisdom. And I've always proudly said that in Indian culture, senior citizens have traditionally always been treated with a sense of reverence. And we want to be able to preserve that, right? Now we talk about technology. Technology and hand on heart, right? To be honest, can only play a role of an assistant. At the end of the day, it will come down to each one of us to drive and master the change that is ahead of us. With that, I want to thank you all again for your time and attention, and I would hand it back. Thank you.
Thank you, Mr. Singhal, for the theme address. Can I request Dr. Sudhir Kalhan to make the industry address? Mr. Kalhan is also the chairman of the ASSOCHAM National Healthcare Council. And I would also request, if possible, the speakers can keep their videos on. Thank you.
Thank you so much. Now, as chairman, National Council for Healthcare of ASSOCHAM India, I would definitely like to talk about the problems which are specific to India. So if you see the Indian population, I think the previous speakers have already talked about how the demographics are changing and that we have more aging population. The life expectancy has gone up, and so are the problems related to old age. Now, if you see India, we are very diverse. And when I mean diversity, that means the kind of healthcare facilities which are available in a metro city might be too different from what we can get in a B2 city or rural India. Again, the accessibility, how easily the elderly can get access to these services are also difficult, and affordability. Because these are specific problems of our own country. Affordability is a very big issue because the penetration of the insurance is very, very low. So we have to talk about these problems. Also, if you see the elderly population, what are the problems which the elderly are facing? Most of them, the non-communicable diseases like diabetes, hypertension, chronic kidney diseases, chronic liver diseases, the pulmonary problems that we are facing because of the environment, the chest diseases, all these require a regular and constant follow-up. So what do you do for that? I mean, it is very difficult that somebody from the house either takes an off and to get them to the hospital again and again. And that is a very big challenge. Fortunately for us, I have seen that over the years, it has always taken a crisis to shake India. And this pandemic has actually shaken us and made us realize that something needs to be done. And technology has come to our rescue. You see, when India healthcare was planned 50 years back, it was planned like a pyramid, with a broad base of primary healthcare system, which was focused in small villages, small towns. And then you had the secondary level, and then you had the tertiary care centers, which were based in the metro cities. Now, if you see in the last 30 years, what has happened is that you have the Apollos and the Gangarams and the Max and other things coming up in the bigger cities. You have at least 20 corporate hospitals in Delhi, Bombay, Bangalore, Madras, but you don't even have a primary healthcare physician in the PHCs that you have. So not even a single doctor covering maybe sometime 10 villages. So I think the government also realized that, and I'm glad in the last budget, the focus by the health minister, the finance minister was that we have to provide bandwidth, that means the last mile connectivity to all villages. And I'm glad that they gave a smartphone to all the multi-purpose health workers. When, recommendations were taken from ASSOCHAM, we had actually recommended that, first of all, do a simple thing like providing a smartphone to a healthcare worker, because that immediately connects us. I mean, let us not focus only on urban India. Urban India is only still can manage the problem. What about the huge, large rural India, which is not totally disconnected, has no accessibility? So these healthcare workers, if they have a smartphone, and I'm glad to share with you in the last 8 months, as chairman of the surgical department of Ganga Hospital, we developed our own phone application. It was a simple phone application based on a smartphone. We could talk to our patients, we could interact with them, they could upload their reports on their phone, we could see those reports, we could have a meaningful conversation, and I could send them a printed report. And in the last 8 months, we have done more than 30,000 consultations with that. So that has made us realize the importance of technology. But one thing about technology, is that when we talk about technology, we tend to, swing from one extreme to another. When the pendulum starts swinging, you go from one extreme to another. And I've been a part of many meetings when we talked about digital healthcare technologies. They talked about how we can take the ECG online, how we can take the breath sounds online. I think in terms of technology, we have to take baby steps. That means, first of all, it should be a D2D connection. That means a doctor to doctor, like a primary health center. Then we have to keep the technology so simple that an elderly person is not afraid of that. It should be as simple as a WhatsApp. That is the bottom line. That should be a gold standard. Technology should be as simple as a WhatsApp. That means an elderly person can upload his reports, talk to his doctor, see his prescription. There is a simple payment gateway that is required. And also there must be alerts. So what my recommendation is that, and we have started doing it, let's say that we have some elderly people registered with the hospitals. So you can have, let's say, a monthly visit of the healthcare personnel, which you can go there, they can do their checkups, they can monitor their vitals, and they can leave an emergency number or an alert. That means whenever there is a problem, the closest hospital gets an alert, an ambulance can be sent, and they can be brought back. An alert can also be sent to the closest relatives, so they also know that there's a problem, and immediately services can be provided. Because this is a population which is very vulnerable. As rightly said by my previous speaker, the infants and the elderly are two vulnerable people, and they don't give us too much time to act. So it is very important that we act timely, we are a little sensitive towards them. And not only healthcare, I'm again saying that more and more money should be spent on the primary level, prevention. If we start monitoring our elderly people when they start entering the age of 50 and 60, we see to it that their diabetes is under control. I can assure you that the kidney diseases will go down, their eye ailments will go down, the liver problems will go down. If we monitor their hypertension and see to it that proper medicines are given for the hypertension, I'm quite sure the incidence of cardiac diseases will go down, the incidence of CABG will go down. So that has always been my humble submissions to the government of India and other bodies, is that 10 rupees which is spent on prevention saves 20,000 rupees of the treatment. So it is very, very important that we, not only talk about technology. Let's say, the previous speaker was just focusing only on providing the problems. Once they're there, you give them a host of technology, but let us use technology to prevent the diseases. To ensure that the elderly are given the flu shots which are required, their diabetes is somebody is monitoring through a central agency, their hypertension is being monitored, and whenever there are small red flags are raised, and we see to it that diabetes doesn't go out of control, and that can go a long way in preventing them from becoming invalid and having a lot of problems. Also, we must understand that the elderly people not only have healthcare issues, they have mental health issues. They undergo depression, they don't have people to talk about. And so we can, have maybe a small groups for them where a psychologist or somebody can interact with them regularly, address their psychological problems. And also very important that their security issues, they can all be clubbed under technology. So one simple monitoring of an elderly man, ranging from preventive health checkups to regular follow-ups to regular alerts to mental health issues to monitoring their security. These are not things which will require a lot of money. You don't need any special. So if these are simple solutions which can be provided on their smartphones or on the iPads. So that is my humble submission to the people who are providing technology to all the elderly people. Please keep it simple, please keep it inexpensive, and please keep it practical. Thank you.
Thank you, Dr. Kalhan. Can I request Ms. Sama, please, to kindly make her address? Over to you, Samaji.
Thank you, Varun, and thank you, ASSOCHAM, for inviting me for this conference and on such an important topic. My name is Sama Beg, and I'm the Chief Product Officer at Emoha Elder Care. And Emoha is a young technology startup that was founded by individuals like myself who were first sons and daughters. And our vision is essentially to try and ensure that elders can age in place in the one place that they love the most, that we all love the most, which is our own homes. And we try to make sure that the elderly can live comfortable, safe, and meaningful lives in their homes. I'm here today, though Varun and I was introduced as the product officer, but truly I'm here today as a daughter, which is, I consider, the most important role that I have. As a daughter of elderly individuals in their 80s, I was managing Alzheimer's assisted living homes in the United States for a few years and had to quit my job and moved back. And the reason for that was because there were no solutions for my aging parents at home. They were struggling with managing their emergency situations. My mother had had a fall. They were struggling to manage and monitor their healthcare. Both of them have chronic conditions. They were feeling very lonely and they weren't very engaged. And I realized when I moved back that I'm not the only person. There are hundreds of thousands of children and elders who are struggling with the same problems. And what COVID has revealed, and like the speaker before me mentioned, unfortunately, sometimes it takes a crisis for us to realize. But what COVID has revealed is how broken our system is. Elders live a very disconnected life. Unfortunately, COVID has accentuated that disconnected life. Their predominant solutions in the industry for elders are around assisted living or retirement communities. But 90% of elders, like Dr. Chanana was mentioning earlier, majority of elders would like to live in their own existing homes. Assisted living, although very essential for individuals with different types of dementia or chronic conditions, assisted living is typically not very affordable. And so this is where technology can step in. Technology is a powerful and a very scalable method of ensuring that an elder can live a meaningful and comfortable life in their own homes. This is exactly what we're doing at Emoha, and we have realized through a lot of research, through a partnership with the MIT Systems Dynamics Lab, we've realized that the life of an elder, 80% of the challenges that they face are actually not healthcare problems. Healthcare problems are a small aspect of their day-to-day life. 80% of it is actually the fact that the maid didn't show up and they can't figure out what to have as a nutritious meal. 80% of problems revolve around the fact that they may have a fall because the risk of falls increases. And they're too afraid because their house, their home, their bedroom, their bathroom may not be designed in a way that is elder friendly or safe for an elder. So elders struggle with a lot of challenges that are not necessarily healthcare specific. And the primary challenge that most elders around the world experience, and this in fact is a global pandemic that preceded the COVID era that we live in, is loneliness. Loneliness and a lack of relevance or purpose is a pandemic that is a global phenomenon. And depression amongst the elderly is actually connected to an increase in chronic conditions. So how can technology help? One of the things that we realize at Emoha is that through devising simple solutions where you can stream solutions into an elder's home. For example, we piloted a program called Emoha TV, which is a virtual community of elders. Every day, 3 times a day, our elders in the Emoha community come online on Zoom, and they've stitched together beautiful friendships. I'd love to share the story of one such elder, Bisham, who lives in Pune. Bisham lost his wife and his only son, lived alone, was struggling with depression. But after becoming an Emoha member, his life was transformed. He's reimagined what it means to be an elder. He has reimagined elderhood because every day he dresses up and he looks forward to meeting other like-minded individuals through our virtual community and has developed deep friendships with each one of them. So technology has a beautiful way of solving for the challenges and creating a means to make the foundation of the home that the elder lives in much, much stronger. We believe at Emoha that elders, unlike the typical bias in the industry, that elders are actually people who enjoy using technology. In fact, there's a lot of studies around Facebook and social media and the adoption of WhatsApp. And the elderly are the second largest group of Facebook users worldwide. That is a huge, and there's 1 billion users on Facebook. The elderly are the fastest growing adopters of Facebook. So we believe that there's a tremendous demographic dividend in elders, and that it's very important that we recognize that the elderly are like a treasure chest of wisdom, of knowledge and experience that is waiting to just be unraveled, waiting to be discovered and explored. And we think that technology can help significantly in solving the challenges of day-to-day life. Healthcare being one aspect of it, but everything outside of healthcare being a very critical aspect as well. 2020 has been, in our words, it has been the year of the elder. More than 500,000 elders have lost their lives around the world because of COVID. Many of us on this call perhaps know of an elder who may have lost their life because of COVID. And we really urge that everybody look at elders and consider elders as a tremendous asset to our communities. And we work together, communities, governments, and society and businesses at large work together to solve for elders living more comfortably in their own homes. So thank you again, ASSOCHAM, for inviting me for this very important topic, and I look forward to the discussion.
Thank you, Samaji. Now can we move on to the discussion? Ms. Upma Srivastava, the Additional Secretary, has been called to administer the oath on the occasion of Constitution Day, so she will be joining a little late. Can I request Satish Kaushal ji, Executive Director, Government Advisory from EY, to please start the panel discussion. Over to you, Satish ji. You're on mute. Satish, you're on mute.
Okay. Good afternoon and namaskar. Can all of you hear me, please? Okay. So thank you, ASSOCHAM, for putting up such a lovely agenda today on a topic which invariably is not discussed in my last 35 to 40 years of engagement with the industry, with different organizations and government. I have hardly come across such a topic being discussed. So that excited me to come and participate along with you people. And also, once again, I appreciate the type of panel you have put together. The panel today consists of renowned industries people. There are professors from the medical stream, and there are people who have been engaged in innovations and providing different type of solutions. What I would set the agenda is, since we have been given about 45 minutes and there are 6 speakers, I'll urge all the speakers to stay within the confinement of 4 to 5 minutes so that we can have any interaction thereafter the discussions. Plus, I would give a very brief introduction of this, the panelist who is going to speak after the first and the second one. I would try to limit my questions to 2 or 3 max, and the answers could be centered around those questions. So we start the panel discussions today. Most of the previous speakers have laid a good background and a preface to what we should be discussing. We like to raise the bar of the discussion a bit beyond or involving most of the things that people have talked about. Our first panelist today is Dr. Sumit Chowdhury. He's the founding chairman of a smart city organization called technology organization called as Gaia Smart City. Sumit has worked extensively in leading organizations like Reliance Jio, IBM Global Business Services, having been the MD of Bearing Point and KPMG and others. Welcome, Dr. Sumit Chowdhury. Sir, my viewpoint out here is that from your profile that you are driving innovations and leveraging technology to provide state-of-art facilities and a differential experience to citizens in the smart cities where you are involved in. So my question to you would be, do you see a demand of providing digitally led healthcare solutions for aged people in the domain that you are working? And the second question could be, what do you think who would be the stakeholders to increase the demand for making a sustainable business model for providing healthcare services to the elderly people? And when I talk about elderly people, I'm taking a population of plus 55 and above in the areas which are now being covered under smart cities.
Okay. Thank you, sir, for the introduction and the questions which you have asked. I think very pertinent because we have been working in the smart city space and in the space of providing technology to our citizens, and citizens also include the aged care. And most of the thinking that we have done around providing healthcare is to ensure that the supply side is taken care of, and there are enough providers who are able to go and service the needs of the elderly. I think the speakers before have spoken very clearly and have outlined that the elderly are alone, they are at home. They would have to be serviced at home. So we need a lot of last mile coordination of healthcare workers to go and service. Now, how do you know they need service? And there is a lot of technology being built right now to alert healthcare workers as well as officials to know when somebody needs service or when somebody needs assistance. The other one could be periodic assistance. So what we have developed is a set of tools such that the healthcare workers are able to do periodic as well as emergency related last mile delivery of the services to the aged care. And this we think is going to solve a couple of the problems. There are a lot of problems, as I said. Not all of the requirements are healthcare related. They could have a fall, they could need food, they will need a whole lot of things that they need. So what we have tried to address is a way for citizens, especially elderly, to request for services. And in the COVID times, we have seen that this demand has gone quite high because they needed food, they needed supplies, they needed support in many more ways than we had imagined before. So essentially, you need the last mile coordination, and we have built a whole AI-led platform which is able to coordinate both managed as well as emergency care, which is dynamic tasks for the problem that we have seen is that we don't have enough qualified nurses or qualified healthcare workers who are available. So how do you optimize the fewer people who are there to service a whole lot of people? So you have to Uberize the whole concept. You cannot have dedicated support in many cases. So what we need, answering your second question, is what we need is our healthcare providers coming together on a platform which allows them to be called. And again, technology exists, and our previous speakers have talked about that technology to be available to them both digitally as well as physically, because a lot of times you need to go there and see, and you can't do that dedicatedly. So you need to be there as and when required under emergency services. So we have built that technology around supporting the citizens in that way. As my second company, which is Sesovera, a very interesting offshoot from our previous company, we are looking at voice enabling the elderly for, in many cases, when they don't want, we heard from Abhinav that the elderly don't want to wear any wearables, but when they fall, they can use their voice to call out. And we have built a internet-free voice recognition platform which allows the elderly to speak out what they are looking for. They can be on the bed and ask for the lights to be switched on and the AC to be switched on without having to move. So we have enabled a voice activated household, which is not a smart home. It doesn't require an Alexa or Siri. It is essentially a very small microprocessor which can be trained in any language to react to commands from the elderly to take care of some of their needs. And that's the kind of things that we are working on today, so that the elderly is supported. So I'll stay within the limit of time and hand it back to you, sir.
Thank you very much. A small question though remains. What do you think would be the demand creation enablers? And are you doing some sort of pilot projects with the applications that you have built? And what has been the response?
So our pilot project has been in the city of Agra, where we have got both. We have got this demand supply thing. The biggest problem we see is the availability of supply of people who can go and do that. If somebody requests and there is nobody to respond to it, then the demand will not grow. And there is a community which builds up around elderly, and it spreads by word of mouth that there is somebody who is there available to come and help, and communities help out. So volunteers in the community can be on that platform to support the elderly in that community. So we have built a platform where the community can support the elderly and then take assistance from healthcare workers as and when required. So the biggest problem we see is the availability of the community and availability of healthcare workers on that platform. And if that happens, the demand will grow. Demand means noted demand. The demand is there. We just need to put it into a digital platform so that we can measure the demand and also provide for the supply that is required for that demand.
Thank you, sir. I think one of the action points from this particular experiment of yours, if I can put it in quote unquote, could be how do we build a platform to do both scale and speed of such projects.
Absolutely.
So I would now invite Dr. A.B. Day. He's a professor and head of the Department of Geriatric Medicine, National Center of Aging, All India Institute of Medical Sciences. He has done his MBBS and MD from Utkal University. He did his senior residency from AIIMS, New Delhi, and was recipient of Commonwealth Medical Fellowship of Royal Victoria Infirmary, University of Newcastle. So he's an expert in the field of aging challenges. So Dr. Day, while India is still demographically a very young country compared to many others, but with the general living standards improving, higher life expectancy and birth control, we are also fast moving into a growing aging population, which is known fact. Since in 1961, we had only about 5.6% people above the age of 60, and it is projected that by 2026, we may have almost about 12.6% of the then population as part of 60 plus population, which may translate into 14 crore people. So the questions that normally come to our mind is what type of medical facilities districts in the country should prepare in coming years to serve this section of the population where primary health services are quite a weak link in our health ecosystem. So that's the key question. What should be the preparedness of the country at the district level so that better health services can be provided?
Good morning, everybody, and thank you, Mr. Kaushal, for the introduction and the question. And that geriatric medicine or old age care is a recent thinking, but people used to age and happily age into their 70s, 80s, and 90s, and very rarely to hundreds, with or without good or bad health or whatever you can say. The issue became challenging when we found that as of today in 2020, 10% of Indians are above the age of 60 years, and many of them retire either by chronological cutoff or by physical ill health. So obviously there's a need for support from the society, from the health system. We in the health system, in all these years that nearly 5 decades that I'm in the health system, I retired in August, that old age care was considered as a kind of pediatrics of 50s and 60s, that you reduce the dose by half and that's the dose that a kid will require. So old age care will be like you reduce the dose a little bit and the older person will be happy with the treatment. But now we understand that it's not that simple. So obviously the physicians and the surgeons and all other healthcare providers as well as paramedics do understand that older people are a bit atypical in most of the things. So how in our society or in a health system in India, what are we doing? We had programs, policies, legislations, all there in place in last 20 years. But the implementation or kind of the last mile kind of thing is always lacking. So most health providers do not have much training in old age care, and obviously there the problem starts there itself. And we now understand by WHO's prediction that in next 10 years, there will be a huge deficit of healthcare providers all over the world, India included. So in that scenario, what sort of services should be provided in the distant most society, in villages, in districts, in small towns? Though the government has now 2 things have happened. The health and wellness clinic, which is 30,000 are in place, another 1,20,000 in the offering. Of that, one of the vertical is old age care, and allied to it, the palliative care and mental health care. So 2-3 verticals looking at old age care in health and wellness system. If COVID would not have come, by this time, most of the geriatric things would have been rolled out. The NITI Aayog and Department of Health Research and Health Ministry are working on this. The other thing that has happened, the most dramatic thing that happened is the Ayushman Bharat tertiary care insurance scheme, which has really made people have the ability to access best of care anywhere in the country. For those who cannot afford those kind of tertiary care interventions. So we are looking at, after the COVID goes off, we can look at that older people are much better cared of in next 4-5 years time in a part of the system. But more importantly, the healthcare providers, doctors, nurses, paramedics need to know a little bit of old age medicine so that they can handle them better.
Sir, my question to you would be, what type of common diseases afflict old people, and what is the availability of technology assisted symptoms to be communicated from the person affected to the nearby hospital or doctor? Telemedicine could be one part, but then when it comes, it comes.
I will split this question in 2 parts, the health problems and the technology part of it. Virtually everything happens in old age, but in a more complex and complicated manner. For example, our number 1 cause of death is heart attack and stroke. So obviously hypertension, diabetes, heart disease, stroke, they are the bulk of illness that we see in our care, whether tertiary or primary or secondary. Everywhere these cardiovascular metabolic problems will be there. Cancer has become a number 2 cause of hospitalization and death because of our lifestyle and pollution and smoking, etc. We have the issues of chronic lung disease. All of you who stay in Delhi can understand chronic lung disease, COPD, is very common because of pollution as well as smoking. And now pollution is also linked to poor mental health. And linked to that is the mental health issues of depression, anxiety, or mood disorders. And as we go into 80s and 90s and 100s, maybe a cognitive impairment coming in. So if we are looking at this kind of illnesses, have got core geriatric issues of becoming frail, weak, bedbound, fractures, osteoarthritis, replacements, they also have their place in the under the sun. So how we look at them from the technology point of view. The first is detection of non-communicable diseases by distance modes, in which All India Institute of Medical Sciences in some of our colleagues have provided an NCD detection, kind of a chair kind of thing. The person sits over it, and soon this will be in market, and the NITI Aayog has accepted this to be placed in most primary and secondary healthcare centers for detection of non-communicable diseases, all sorts of them on a distant mode. Second is, people need, after the COVID pandemic, the desire to see the doctor and gossip is over. Now people want that everything should be from the home setting. That we are in a current months, our experience is if there are 100 appointments to AIMS geriatric medicine OPD, hardly 40% come because people are scared. Everybody wants things to be done in distant mode. So distant mode healthcare delivery, that is the challenge for the technologists and the systems to provide telemedicine or whatever you give, name, app or mobile phone or whatever. And we have the issue of preventive healthcare, and WHO started a AIM health program in which we participate, AIM aging program in which we send a series of SMSs to older people who are part of the system so that they have some health system, health care, preventive health intervention. To say mobile telephone app is only the tip of the iceberg. We need technology in a big way, especially in a post-COVID scenario. Let's understand post-COVID scenario will continue for next 5 to 10 years, where people will be scared to come to hospitals, as we see now. So how to connect older people with their complexities for curative as well as palliative care, symptom management, diagnosis. So these are some of the challenges that the business administrations, business associations have to look at and provide solutions to.
Thank you, sir. It was very enlightening. And as an action point, I would recommend to Varun to possibly have you as one of the speakers and an advisor for this sort of a group that we may create for a better information dissemination to people and some of the new solutions that are coming up. I would now invite Mr. Vikram Thaploo, who carries a tremendous experience in heading different leading startup companies in India. And he currently holds a global portfolio as the CEO for Reliance Healthcare Vertical, Telehealth and mobile health applications of Apollo Hospitals Group. Mr. Thaploo, in Indian context where largely healthcare is a reactive situation to an event, what solutions approaches can be enabled by technology to provide healthcare services proactively? And I emphasize on the word proactively. The previous speaker also talked about it, especially to people who are above 60, and largely in India, the elderly people are dependent upon their children or the next person who is giving them the care. So that is where I think, as a startup a person who has lived with large number of startup organizations, if you were a venture capitalist, what type of organizations you would put your money in and see their outcomes coming up with a better return to their investments if they were to build a solution in the digitally assisted old age or aging population?
So thank you, Mr. Satish, and thanks to ASSOCHAM for this chance to express the views. Basically, very interesting question. I think there are three parts to your question. One is, I would say, the healthcare. Second was more to do with technology, and third is to do with the comfort in the business model of it. So I think from a standpoint of when we talk about Indian context where it's reactive. So point one is reactive healthcare management is mostly required for the pandemic situations like COVID. And I think we need to change the entire approach and make it more proactive. Having said so, in the last maybe a decade or so, the adoption of technology has been very good. Now, currently, the elderly population who's just getting into the threshold of being 60s were in their 30s when the technology boom started in 90s. So I think technology savvy elderly population is what we are into. Makes it a bit easier. Secondly, what happens along with this, that hospital systems like Apollo, where I am part of, we are focusing on shifting the point of care out from the hospitals back into the homes. This was a phenomena which had started before the COVID itself, I think many years back. When we shift the point of care, it becomes very important to take support of the technology. Now, home care systems, which Apollo runs, are today probably taking care of more than 4,000 geriatric patients. And actively, maybe 400 patients would be right now being monitored. From a telehealth perspective, where I lead the bandwagon, we have been working closely with the governments in elevating the systems at the primary healthcare level, because a dollar invested at the public, the primary healthcare in the public system is close to $15 to $17 saving at the tertiary care. And this data has been kind of validated when we are treating a large population. Let's say we are running the primary healthcare centers in Andhra Pradesh. And what we see, the elderly are very open to adopt technology if it helps them take care of their healthcare. Even if they have to physically come into a primary healthcare center, but if they are able to speak to an endocrinologist over telemedicine, they are doing it pretty decently and happily. If they are able to speak to an orthopedic doctor and do a pain management with the doctor over telemedicine, they are doing it very, very comfortably. So that is one part of it. I would say adoption has been good and it is growing. COVID has been a catalyst and that has ensured that people adopt it a little more comfortably. And healthcare systems are geared up to shift point of care everywhere. Now comes to the second part. What would be the where would we like to put the money? See, as every speaker talked about, the population of elderly is going to increase. We will have a, though it's a niche market, if I talk it up from a market point standpoint, 10% of Indian population today is geriatric, putting rural and urban together. We are expecting this to grow up in next couple of decades to a sizable number, which means that the business is going to increase as we go forward. Right products, right platforms, as Mr. Sumit also talked about, right platforms which are dependent and independent of internet, which are fit for a use case, are what is required. So what use cases or what technologies, what companies solve these use cases and cater to a niche market are the companies which will get support from funders. That's, I think, what I would like to put forward.
It's a very diplomatic answer. I can appreciate what you just now said. But do you really see a serious business case for health service providers for elderly people just as one segment? Or it would be just an extension of various health services?
Sir, I think very important extension of health services. If there's a healthcare system which extends geriatric care, it becomes much more easier because you are well stitched back into the system. But having said so, India today is expected to be around $7 billion as a geriatric market, while as US is 740 billion, so it's maybe a meager 1% of it. But with the change of mindset, with the adoption of technology, and with the cultural change, because though we want to save our culture, but we are more and more getting Western. Elderly are kind of trying to be independent of their kids. As you see, the trend is there. If a kid is taking care, fine. If the children are not taking care, they are independent to an extent. So with that, the market is slated to grow, and this market will be definitely a segment by its own.
Okay, great. Thank you very much. My next speaker was Mr. Jaiswal, who is currently at the Ministry of Health Affairs. He may take a little time to join, so I'll meanwhile invite Mr. Puneet Gupta, who is the Director of Product Management at SAP Health Services. He has been holding different portfolios within his own organizations, has been in the product development for many years, and has worked in different geographies. He is currently involved in the product innovation responsible for the healthcare providers across the globe. So Puneet, questions to you would be that where we see a big shift from the government provider of health services to a consumer of the health services. What are the viable technology solutions and models that can be optimally prepared to provide industry a major role for the aged people, especially when governments have a major focus on youth and earning population? How can the adoption of technology be made all pervasive and linked for receiving health services in near online basis? The previous speakers talk about making it simple, making it easy, making it in the local languages, making it as simple as WhatsApp. What do you think when you actually get down into the details of a domain solution wherein a patient or a prospective information seeker tries to get a real health solution, wants to share his previous health record with a doctor? It is not going to be as simple an application as a WhatsApp, where it is only a communication one way or two way and a message being sent. But it's a serious business and a serious concern of between a doctor and a patient. So what do you think could be the way that the product's development for such complex requirements of a health domain could be done to simplify? Puneet?
Can you hear me, Mr. Kaushal?
Yes, I can hear you now.
Wonderful. Thank you. First of all, thank you for the nice introduction and having me in this panel, which is discussing a topic which is close to my heart, right? Now, there are two aspects to your question. One is as government moves from being the provider to the consumer of healthcare, what technology can do to support this ecosystem and the shift that is happening in the focus areas. And second is what as technology companies can we do to increase the adoption of technology, right? Now, talking about the first aspect, right? It is good that government realized that it cannot be the provider forever, right? In a country as vast as us, which such a diverse population, such a growing population, and population with spread across the country, it was always difficult to build capacity and have the healthcare infrastructure available at every remote corners of the country, right? What we need to figure out or find ways of doing is, first of all, how can we leverage the existing infrastructure, existing people that we have in the optimal manner? So for example, why I say this is, I have seen people not going to primary centers even when they are sneezing or coughing, right? And the problem is there is lack of trust there. People still want to go to the tertiary healthcare, even for sneezing and coughing sort of problems. And that is what causes a lot of burden on our already fragile health infrastructure. That has to change. And for doing that, there is a three things that I recommend needs to be done, right? And technology can play a role. We as technology provider can play a role in all these three dimensions. Number one, we have to focus on prevention and healthy behaviors. We have to find ways of incentivizing these healthy behaviors, right? People spoke about wearables, people spoke about smart communities, smart homes, providing care at the point where the care is needed, Uberizing of healthcare staff, right? All these things are where technology can play a role, and we have seen a lot of impact being created globally through such initiatives. We don't have to look at just healthcare, right? We can take learnings from Swiggy, for example, how they are delivering food parcels to wherever it is needed, how Amazon is delivering their packages, which is bought, right? Why can't we provide uh, a person who is supposed to go and provide medication or let's say an injection to an elder person at home, right? This can definitely be done. We can also leverage initiatives like Skill India to have special emphasis on promoting the education and skilling of these health workers, right? And I also heard from the speaker from Gaia the excellent work that they are doing in this area, right? Second thing I believe is when we talk about promoting healthy behaviors, right? The way our insurance systems are designed has to change, right? What I mean by that is our insurance systems are all service-based systems. You fall sick, you go to the hospital, that will be reimbursed, right? There are no models available that I'm aware of which provides for long-term care. A Portia, for example, right, just as a healthcare provider, if they are offering a package to a person who is suffering from a chronic disease, where they are going to have multiple consultations over a period of time, there would be regular checkups, there would be regular visits to the person, why can't that be covered, right? And there are examples globally. For example, there is an insurance provider in UK named Vitality, that incentivizes such behavior and allows for such care plans for the elders and the normal population as well. And we have to see how we incorporate that. And those behaviors can be tracked through technology again, right? And that is a critical role that technology can play again. Now, when we talk about how technology can be adopted by people, right? We have spoken about it is very difficult for elders, but what we are forgetting is that it is also difficult for healthcare workers today, right? How many of our healthcare workers are trained enough to know how to use technology, the mobile phone in the optimal manner to be able to provide the right care at the point of care? Uh, that also needs to be looked at. And as technology provider, it is our role to make our technology more inclusive, more intuitive. I heard one of the speaker talking about voice systems, and this is something which we also tried and experimented with in two cities, Bhiwadi and Coimbatore, and had great outcomes, right? So people don't have to necessarily. I remember times when my father was on the phone, basic phone that he had, he only was aware of the red and the green button on the phone, right? He never even could store a number on his phone. But during times of COVID, I have seen similar people from the similar age group doing WhatsApp call, doing Zoom calls, celebrating festivals together. Uh, and elders are the ones who are most active on technologies like Facebook. I mean, there are family groups. Each one of us would be part of such family groups. And you would see most of the forwards and messages come from the elder population. So I believe technology has two dimensions. One, the people who are going to use it, they have to be trained. And we, as technology provider, have to make technology inclusive in a manner that it can be used in a non-invasive manner. So that's my view on that.
Thank you, Puneet. It was quite enlightening. You covered few of the areas. I have been given a message that Mr. Govind Jaiswal, the IAS Director, Ministry of Health and Family, Government of India, has actually taken time out from his current meeting and is available to us for 10 minutes. So I may be excused for not asking you in the next series of questions. If time permits, I'll come back to you.
Sure.
Mr. Jaiswal is a 2007 year batch IAS officer and has worked in Goa and other places in different capacities, and he understands the government outlook towards health, towards industry pretty well. Welcome, Mr. Jaiswal. Are you able to hear me?
Yes, sir. I'm able to hear.
Okay. Thank you. My name is Satish Kaushal, just as an introduction, and I'm an associate partner in Ernst & Young. We work very closely with ASSOCHAM regularly, and we have a very large group of people listening to you, plus the panel consists of many, many known people in the industry from the medical science, medical professors, plus also some CEOs. So since it is a technology-led seminar or a webinar, I therefore had a chance to look at the national policy for older persons, which was launched in 1999, and the directions that have been given by the central government to the state governments. One of the key things that came out was an act which was passed by the parliament, wherein it is expected from the youth in the country to take care and the best care to be provided to the parents. So that's a part and parcel of the policy. These particular policy document, which I could lay my hand on, and multiple links with the Niti Aayog, I could see large number of data points, both on demographic side, that various state governments have different types of aging challenges, then education, then women outlive men, but men are on their own able to earn, whereas women are dependent on their spouses and children largely, as a percentage of how many people are independent beyond 60. But what struck me, and that's a question that I wanted to ask you, was there is no mention in the policy document of any technology use. How could a technology be the fundamental enabler in the changing times when government of India has a plan for making India a $5 billion digital economy, sorry, $1 billion digital economy by 2025. There is no such mention in this policy document. So my question to you is, were you thinking of introducing that as an addendum or a second area, or you thought first that let this policy go ahead and then in the next phase we will do it? So what is your current thinking of integrating technology as a piece of enabling better health services from the government hospitals to the aged people as a policy?
Thank you, sir. Before taking your question, I just want to mention that I have worked in very, very remote area as well as that metro cities also. I have worked in Nagaland for 6 years, Arunachal for 2 years, then Goa, Delhi, and UP. I am from Agmut Kadar, so out of 13 years, I have worked 8 years in the Northeast. So what I realized, like India is a very vast country and it's very difficult to make a uniform. Obviously, we need a policy, but a very monolithic policy will be very difficult to execute in India, as well as health is a state subject that we know. Government of India is in the mentor role and state government has to implement. So while talking, earlier I was in other side, I was in the state government. I joined Ministry of Health in last 2 months back. So before coming to Delhi government of India, I was in Arunachal government. So what I realized, every state, that's what very contrast I will tell you. When I was in Goa, Goa is very ultra modern and it has reached the second stage of level in all the aspect, in all the development aspect, health aspect, health indicator. And after that, I was in Nagaland and Arunachal. So they are on the another extreme side. So it's very difficult for anyone to believe and even imagine what type of basic facilities even in such area, because even for 1 year I was near the just Burma border, is a district called Kifre. It's just 50 kilometers from the Burma border. So how it is difficult to make a policy which can benefit India as a single model. Regarding the technology, I don't know what about the cities definitely will get benefit, but the such area like Arunachal Pradesh, Nagaland, Zunoboto, Kifre, I'm sure many people even have not heard these names. It is so useful when the government of India started eSanjeevani and recently Health and Wellness Center, where they are giving consultation through telemedicine, all the facilities going on. The young people, they are able to travel. There are in a certain area of Arunachal, you have to walk 10 to 12 hours to reach to even any nearby road actually. Forget about hospital, even nearby road also 10 to 12 hours you have to walk. So young people, they are able to manage. But regarding this elderly people, they are getting more benefit from this digital technology. The digital platform, that eSanjeevani telemedicine, which has been started by Government of India as well as state government, is also facilitating. But a state like Goa, it will not be very successful. I'm telling you, because they have already within a 1 kilometer span, they have so many medical facilities, so they are able to go and definitely till now India preferred to a physical interaction compared to this virtual interaction. Regarding coming to your question, this will be second phase. Obviously, it has started. If you see the universal health coverage, sir, that is also incorporated the National Digital Health Mission that the Government of India already started all the health record of every individual, which will be linked with the earlier record also. So that policy, that work has already started at Government of India level. Initially, there was a certain apprehension regarding physical infrastructure, recruitment, all those things. If you see the NHM policy, National Health Mission policy, which was started last decade, so that time the basic concept to develop the physical infrastructure. But now that is also shifting. When we have enough physical infrastructure, now there are certain area it's very difficult to send a doctor. Now our internet access is very good. Even the remote area of Arunachal Pradesh, Nagaland, Manipur also. Assam is having excellent network area. So Arunachal is that is very difficult terrain that I have worked in last tenure. So in those areas, definitely such type of technology people are accepting, and actually elderly people are more on the receptive note. They are getting more benefit compared to the young population because they are able to walk and go to the district. They are able to go to the district hospital. So I'm sure that the second phase, whatever you say, already started under the National Digital Health Mission, and lots of the people, especially the remote area, they will give the max. They will get the maximum benefit from this National Digital Health Mission, sir.
So, sir, basically you touched upon a very key point that Government of India, through Honorable Prime Minister's announcement on 15th August, announced a National Digital Health Mission program under which the electronic health records of all the citizens will be created, and then there will be interoperability, movement from one place to the other, movement of the one from one doctor to the other. The citizen need not carry the entire bag of records, his health vital records plus lab records. It is all connected on the system that would be there. There are two things here, and I have been associated with this mission to some extent. The challenge from the perspective of any program being implemented has two connotations. One is the political impetus or the push behind it, and the second one is there is nothing like a gray area in the technology adoption. Whereas in the health services, our previous speakers have talked about that the most vulnerable population are the kids and the elderly people. So when you go for the health record, digital health records, the priority of services being provided, like now it is being thought for the vaccine to be given, that perhaps could be one recommendation, and I would like to have your thoughts. Can the governments prioritize once in a given district the health records have been created? Can the governments prioritize on these vulnerable people as more of a priority issue than an ubiquitous way of working at it?
Every policy we make some group of people that should get the preference. Every policy you will see that every policy having some this group should get the preference under this policy. Regarding National Digital Health Mission, obviously the vulnerable group it is going on. It is on a very primary level things and already going on, and we are also thinking to go on pilot basis project in some district very soon actually. So that is also there, but as you said, the kids and elderly people are vulnerable group, and they should be given the preference. That I have to see actually. Obviously, I can't comment on the whole government side. It's my personal opinion that they should be given, but that I think it should be there. It should be there.
Yeah, because you know when Aadhaar was getting implemented, it was for all citizens, residents of India, irrespective of their age, irrespective of their gender, sex, and caste. It has to be done nationally. And the whole government machinery was put in. When e-district was getting implemented for services to be provided, it was the same philosophy. But when you consider the health as a subject, and you start giving the records, that is why I use the word how the political will drive it. But actually the need is for people who are not in a position to get insurance or people who are more vulnerable. That is where the first touch me should be there when the electronic data record gets created. So that perhaps could be a matter of debate and discussion. It may have pros and cons, but I wanted your views on that. So I got a personal view, but as an ASSOCHAM, perhaps we may look into it as a policy recommendation. So when do you see the electronic health record projects, say in about 4 or 5 states being implemented. Do you think it is going as per the timeline, sir?
It should be actually. It should be actually. So far we are on the track. So far there is no delay on any time limit.
Okay. Okay.
But in future, I can't commit because of this. The current pandemic situation is also going on, so I don't know whether it will be effect. Actually, such things also encourage to achieve our timeline early. So far there is no delay. So far,
Okay. Okay. Fine, sir. Thank you very much. Appreciate your views.
Thanks.
Okay. I would now invite Mr. Rohit Bayana, co-founder and managing partner of Lumis Partners. He is BE from Delhi University. Rohit did his MS IT from London School of Economics. He was CEO of General GE Software Solutions and worked with the Strategic Initiative Group of HCL. Rohit is currently involved in large number of programs for his organization. He has demonstrated the special medical and outreach needs. COVID-19 has clearly demonstrated the special medical and outreach needs of aging population. In India, where even the primary health services are not up to a minimum desired level, Rohit, question to you would be, what changes in the entire health system be done so that the aging population can get basic health services in next 2 to 3 years? From the government side, you heard their views, and you also heard government is preparing for a national digital health mission, but it may be at least 5 years away when we would see at least 30 to 40% of people covered under it. So in the meanwhile, what would be your views to change and bring in some fundamental changes, and that could be articulated to the various health secretaries of the country?
Sure. Thanks, Mr. Kaushal. So in my mind, as you're putting this whole discussion together, I think the point where you asked me this question, and Puneet coming before this, Mr. Jaiswal coming before this, was very useful. I think data is almost the most basic unit of infrastructure. If data is available, and a great example is what the government has done with Ayushman Bharat. Just quoting Ayushman Bharat for obviously the underprivileged part of society, the government is in a way underwriting a lot of risk that happens by providers catering to the patients, as an example. Elders as a category across equally underprivileged because insurance doesn't cover them. Many other aspects about national care plans don't exist. So in my mind, the moment the government starts setting a policy, sets up a data infrastructure, which by the way, I don't know if it's been discussed so far. I joined this call 5 minutes late, but what has happened with Swasth, what iSpirit is doing in Bangalore, is a great step in that direction. The whole Swasth stack of data provisioning for elders, as well as actually health overall, but elders in a big way, is a massive project. So I think as these things will happen, what we'll see is that elders' ability to leverage technology to consume services at home is really going to go dramatically up, number one. Number two, what we got to keep in mind is today, elders in India arguably use technology, perhaps less than a 5-year-old uses technology. It's strange, but the flip that has happened is what COVID did. COVID immediately forced all the three things that an elder consumes today: health, grocery, and perhaps they visit banks, right? Three things which they used to really have a large part of their time allocated to. Today, they're forced consuming it over technology. When that happens, and when you look at and extrapolate that to see what will happen in health now, the moment you have sorted out the data stack, and I know I'm an elder, I know that my data is with the government, they know government, or it's there on an open infrastructure, and I know that I can use that. They'll know everything about me, from the fact that I'm diabetic to the fact that I have beta thalassemia minor to the fact that what kind of medication I'm consuming. It just changes everything. The great thing about India is we are so entrepreneurial. If this data is exposed in a controlled environment, obviously, if this data is exposed, whether it is through public EHR stack or private EHR stack, doesn't honestly matter. But the moment this data is exposed in a controlled environment, regulated environment, we are going to see all kind of creativity get unleashed. And I'm talking here like an investor, I'm talking here like a venture capital guy. All creativity is going to get unleashed on that data about varied models of provisioning, bypassing the conventional primary healthcare services, figuring out means in which healthcare productivity is going to go. So in my mind, all of that will stand on top of a policy stack of data provisioning.
Good. Could you also share some of your recent parlays into providing health services in India vis-a-vis some of the services that are being provided on a similar stack, say in Australia or in Japan, where the latest technologies are being used, and what could be the challenges here?
Yeah, so actually I'm going to, Mr. Kaushal, start with an opportunity we have, which very few countries in the world have. So rather than challenges, I think we have a massive opportunity. India is the most under-regulated country when it comes to data in the world. We have no GDPR like US and Western Europe, and we are swimming in data more than Africa swims in data. So we have data depth and quality of the level of the Western part of the world, and we have no regulations of the Western part of the world. That in itself is a huge opportunity, because what it means is that whatever sophistication is there today in the Western hemisphere can be made available here. Elderly as a population, just so that, I'm throwing some numbers, $7 trillion of the US economy out of the 22 trillion US economy is elders. 7 trillion, 30%. In India, assume that figure, 80% of the nation's wealth and buying power still sits there. So effectively what we're talking, in a similar fashion. So therefore what we're talking about is, if with what is happening with 5G and us having enough data and enough access to technology, we're going to see the kind of services, forget Australia and others, we're going to see services provisioned here, Mr. Kaushal, which are going to be much superior to that. We just recently, now coming to your question, we recently completed with MIT a survey, which was pretty much a global survey. Many countries were covered. India was one of them, on about what are the various services that elders can consume in this country, which can be benchmarked to similar economies around the world. What came out was that Indian elders are showing trends and signs, limited pockets, but are showing trends and signs of consuming anything which the most sophisticated, mature economies in the world are seeing. You can almost compare this with Scandinavian consumption of services. Forget Australia, forget North America, forget the rest of Europe. So the point I'm coming to is, I think we are sitting on a humongous opportunity. The fact that India is unregulated, finally one day everything will start getting regulated. Even elders, the data consumption, this, that, technology, services, insurance, underwriting, everything will get regulated, and it should. But for the period of time that it isn't regulated is the period of time we have to really innovate here with the best in the world.
Excellent. Your focus has been largely in your talk around the data availability, and that is what the digital health mission would be working on.
Yep.
Ultimately, it has got privacy-related issues, it has got interoperability-related issues, it has got connectivity, it also has the issues around the legal frameworks and the medical rules and regulations, which over a period of time will mature from nowhere to a certain level once you start introducing. But making it simple, today the primary health services in a village or in semi-rural areas are provided by the Anganwadis. And they are the first point of contact in most of the cases in the younger population, but they are not touching the elderly. My question to you could be that do you see that a change in the shift of the capacity building of our health workers, what type of applications you think can be taken up in the next 12 to 18 months that can provide a sort of a rejuvenated and an empowered elderly population from their outreach and connectivity to the nearest hospitals or nearest health workers? Could teleservices be one of that option, or could there be some other models that could be looked into?
That's a great question, Mr. Kaushal. I am not the best person to answer this, considering my focus would really not be on that part of the world, but I'll take a parallel for you, if it helps at all. Rural consumption in India, since you talked about Anganwadis and all, rural consumption in India, we all know is increasing. We all know that, with rural affordability rising, infrastructure hasn't kept pace, however. There are companies today which have created an innovative model in which the Saheli network can be leveraged to provide Amazon delivery fulfillment services in the smallest village you can imagine in the center of Madhya Pradesh. The way that has been done is obviously trapping value and creating services, right? I see no reason why that can't happen in the primary healthcare system or the Anganwadi system in India. That's one. Two, I genuinely think somewhere government, what it has started doing with Ayushman Bharat, will have to really take that on one hand and plug it with fixing the primary healthcare system in rural India, because private sector going there will take forever. And perhaps forever could be 10 years is forever in today's time. And with pandemics like COVID shaping up, who knows what's next? And if private sector isn't there and last mile fulfillment is with the government, it's best that the government focuses there. Just like today, BSNL, let me take a very simple example, Mr. Kaushal. BSNL, Bharat Sanchar Nigam Limited, is the provider of choice wherever private sector can't go. Just like BSNL is there for the back and beyond, government and the Anganwadis and all that will have to be there with the private sector, with the Reliances, Airtels, and Vodafones of the world, focused on the more accessible part where there can be economic value creation, which is why private enterprise gets in the first place, is how it will happen here as well. So your point on Anganwadi seems legit. I see it happening with the Saheli networks in many parts of the economy. I honestly don't know how it will happen in primary healthcare, but I think there's a lot to be done.
Thank you. Thank you, sir. Is Puneet there?
Yes, Mr. Kaushal, I'm here.
Puneet, I had to cut you short, but there are some interesting questions that have come from the attendees. I would put a couple of questions to you for you to think through and talk around that. One question Mr. Sanjeev Dhal has asked is, any technological work being done on wearable communicating devices or peripheral devices, say in their room for elderly people for assisted living?
Absolutely. And that has been the key focus based on the learnings that we had with some of the early experiments that we did. Like Abhinav, during his talk, he also shared that people don't want to be tagged as elders. They don't want to be seen as elders when they are moving around, relying on a wearable which they have to tie around their neck or maybe wear on their wrist all the time, right? And what we learned is, if we can make the spaces where they live smarter, more intelligent, right? There is a startup which was also recognized by Government of India recently. It's named Dozy. What they do is they have created a belt which you can put under your bed when you are sleeping, right? And it will keep on monitoring your heartbeat, your sleep patterns, the quality of sleep that you had, and can predict several possible things like maybe dementia in future, right? Maybe Alzheimer, that you are susceptible to Alzheimer in future. Now, these are interventions which you don't have to wear all the time, but the space where you are living in becomes intelligent. Similarly, what we did was, we also explored experiment with several sensors related to fall detection, right? And when the fall has happened, it is not just important to detect the fall, but it is also equally important to intervene and provide assistance at that point in time, right? So we partnered with some of the community health providers, and we were able to create a level of call escalation mechanism, right? So if somebody who is supposed to be the person who is supposed to respond to that emergency call immediately is not available, the call can get routed to the next level of person in the hierarchy, and we had like 3 levels of such handling of emergency situations. Now, Technology definitely is moving towards becoming more and more invisible, so that people don't have to learn technology, but technology can adapt to the behaviors of people. We were able to see when people are going to bed, right? When do they give up? When are they waking up from the bed? To understand their sleeping cycle, just by using certain motion sensors in the room, right? We were able to understand if a person is normally waking up at 7 a.m. and on one fine day is waking up at 11 a.m. We were able to alert the people who are probably the ones who are concerned about the well-being of this elder person, that something could be wrong. Why don't you call up this person and see if everything is fine, right? So these kind of small interventions, which are, and technology is completely invisible in these areas, right? So nobody has to learn technology. It's just about how do we use technology and make it, accessible and uh, affordable for people. That is what we see is the key challenge there.
Great. In terms of some of the best practices for this segment, would you have one or two case studies which you can quickly talk in the next 2 or 3 minutes?
Yes, several, in fact. So I'll talk about, so for example, we are working with elder community in Bhiwadi, right? What we experiment there was with the voice-enabled technologies. The idea was, the challenges that we faced was, number one, right? People, when they are in distress, their voice changes, right? For example, there is a fall that happens in the third room of your home. Would a sensor be able to detect that call, your call for help, when the sensor is deployed in your living room, right? So that was one. But surprisingly, technology surprised us, and we were able to, see our sensors being able to detect such distress calls. Second, in the same society, what we also experimented with was emergency response to a call in distress. So the challenge there was, would we be able to provide a care? Because your homes are locked, right? Even if you have had a fall, how would somebody enter your house to be of any kind of assistance to you, right? And that is where trust building measures are very important for any such interventions to become successful, right? And what helped there was community building. What helped there was the living society, the elder living society care providers and their network who had the access to these keys. We had to kind of provision for it. But we realized that this trust building is also going to be very important before technology can be adopted.
Fantastic. Thank you very much. I think we are done with our session. If there are any questions from participants, I'll be more than happy to take. They can flag it off in the chat box. I would also, meanwhile, while the questions are coming, I would like to personally thank Dr. Sumit Chowdhury, Mr. Thaploo, Dr. Day, Mr. Jaiswal, and yourself, Puneet, as well as Rohit, for walking us through some of the challenges, some of the innovations, some of the models that are being adopted, how technology could be an enabler in time to come, plus some of the issues that actually are being felt by people. Mr. Sudhir, in his initial spell, had covered most of the issues in a very eloquent way. Mr. Lovneesh, Chanana, and Ms. Beg talked about the practical issues that this particular segment is facing and requires services. Government of India's recent policy promulgation is actually very heartening to see that they are live to some of the challenges that the nation is likely to face when we move from a current demographic setup to the new demographic setup in years to come together. How technology-enabled solutions is viable for this segment if this were to be created. Smart cities today is a reality. Therefore, smart homes is becoming important. But I think the paradigm shift that came out from this session could be put in two parts. One, the COVID-19 has brought in a major change in the way health services are being provided. From a hospital to a home care is becoming a larger segment, and therefore the capacity building of the health workers plus the scale at which the recording of the data, as Rohit was talking about, becomes much more fragmented, and therefore one has to handle from a regulatory perspective. The data will not reside only in the hospitals, be it the primary health centers or government or private. It will now be perhaps much more available in time to come in the home care setups. So therefore the entire model has to be relooked into, and especially with the higher number of aging population, which is a fast adopter of technology, as to the myths that people perhaps would not be if the applications are made simple. One last point is that when Government of India is now talking about Atmanirbhar program, they are talking about applications to replace WhatsApp or mails with the Indian built applications. Perhaps time is not far off when some innovations should be around what health applications can be built for the elderly people in the local languages for their easy access. With that, I would sum up the chat discussion and put it to Varun to take it forward from there.
Thank you, Mr. Kaushal. I would like to thank all my speakers and the panelists and the participants who have joined today. Let's continue this journey, and thank you very much for joining us. Thank you.
Thank you.